And we're checking in with California leaders to see how state services and dollars are impacted by the shutdown. And with that in mind, let's go to KCRA 3 Political Director Ashley Zavala joining us with what state leaders have to say.
Golston and Lisa, day one of the shutdown and no immediate impacts to state services or state dollars at this very moment. We know state leaders are keeping an eye on a variety of issues, and that includes the state's 9 national parks. Plus, that threat of a possible mass federal worker layoff. California has about 150,000 of them, and that number does not include military personnel. Also, this debate over healthcare spending is also a major issue in the shutdown fight that the Newsom administration is monitoring. We should note that debate in Washington, D.C. does not impact California's program that provides health care to undocumented people through Medi-Cal. California uses state taxpayer dollars to pay for that, not federal. In the overall healthcare spending debate, state leaders are bracing for broader impacts to changes to the Affordable Care Act, which you mentioned at the top of the show. Governor Newsom's Department of Finance spokesman H.D. Palmer explains.
I don't want to prejudge the outcome of it, but under current law, the subsidies under the Affordable Care Act would expire at the end of this year. That would affect roughly 20 million Americans who are receiving their care through the Affordable Care Act. Roughly 1.7 million of those individuals are in California. To give you an idea of what size of people that is, 1.7 million individuals is roughly every man, woman, and child in Sacramento County, to give you some type of idea of how many people are involved. And the premiums without that would go up, at least $100 a month for most of those individuals, at a time when, one, that would be prohibitively expensive for many, and two, it happens at a time of significant economic uncertainty. So as Governor Newsom has said, in terms of the efforts by Democrats in Congress to push for the inclusion of this extension as part of a budget agreement, he believes that it's important from a public policy standpoint, from a healthcare standpoint, and he believes it is a fight that's worth fighting for.
So we'll see how that fight shakes out. Again, if this shutdown lasts a few days, Palmer said it'd be considered an inconvenience. But if it stretches into more than a month, the way that it did the last time in 2018, then it can start to create problems with federal workers having to pay for rent, groceries, and other bills in this state.
Yeah, let's talk about the governor. He's been busy online, right?
Yeah, I mean, checking in on his social media, he has been criticizing the president and Republicans in a string of posts on X. For example, he has recreated some interviews that J.D. Vance and Republican House Speaker Mike Johnson, basically making them look like minions from the film Despicable Me. The governor there claiming that those two are President Trump's minions, keeping the government shut down and these health care costs and questions up in the air at this point.
All right, Ashley, thank you for tracking it for us.